Beverly Hills, land of the rich, home of the famous. Sure, the stereotypes exist, but what most people don't know is the truth behind the plastic. If there is anything I have learned in all my years as a plastic surgeon, it's that appearances are not always as they seem. I get patients from all over the world, from celebrities to the average everyday housewife. But there is one thing they all have in common. Everyone needs a lift. Welcome to my world.
My name is Aylen, I'm 19 years old, and I'm from Toronto. This is my first time in Beverly Hills. I'm here today visiting Dr. Kassabian regarding rhinoplasty, and I've heard great reviews about him from my family that watch Dr. Lift all the time, and they understand that I've had some difficulties and concerns about my nose, and it's really brought down my self-confidence, and they understand that if I go through with this surgery, it's definitely going to boost my self-confidence, and it's going to make me a stronger person at the end of the day. I'm here today because I have some concerns and questions, and I'd really like to see Dr. Kassabian's view on what he can do on my nose.
Aylen is coming to visit me all the way from Canada. I know she has an important personal concern to discuss, so let's go meet her. Hi Aylen.
Hi Dr. Kassabian, how are you doing?
Good, very well. How about you?
I'm good.
What brings you in today?
Well, I've always had many concerns regarding my nose, and I'm very self-conscious about it because of the bump protruding out, and I feel like it's always the first impression that everyone sees, and it's really made me self-conscious, and I was hoping you could do something about it.
Sure. Tell me a little bit about yourself.
Well, I'm originally from Toronto. My family lives in Los Angeles, and they've seen your show all the time on Dr.
Fantastic.
Lift. And I've also gone and researched you a little bit myself. I've seen all of your videos, and I absolutely love your work.
Thank you. Thank you very
Thank
much.
you.
Well, tell me, did you fall as a kid? Did your parents tell you you had any injury?
No, not at all.
Yeah.
It just started. I used to have a very little nose when I was young, but when I got to grade 6, it just started making a bump on its own. So I needed to get it fixed because I'm really self-conscious about it.
Well, first I'd like to evaluate your breathing. So I'm gonna take a look inside and see the status of your septum and your turbinates, okay? And then we'll have a plan for you.
Okay, great.
Breathe in, out. Breathe in, out. Breathe in, out. Breathe in, out. Breathe in.
I don't know, I feel like this one's easier.
Yeah. Mirror for a second, just talking to you. Okay, tell me, what don't you like about your nose?
Well, I feel like there's a gigantic like a bump right over here that really makes me self-conscious, and it's just, I don't know, I've always had a problem with it. It always sticks out, and I feel like it's the first impression on my face, so it's just, I just don't like it there, and I wish it was gone.
Okay. So Aylen, take a look with the mirror, and you see your nose is deviated to the right side. It's making like a C kind of deviation, and from the inside, the septum that's deviated is partially blocking your right nostril, right airway. Also on the left side, the turbinate, because there's a big space there, the turbinate has become enlarged to fill that space, so that's blocking the left side. So both sides you have partial blockage, the right side because of the deviated septum, the left side because of the turbinate. At the same time as making the cosmetic changes, I'm gonna make your breathing better. So that's first. Fix the septum, make it as straight as possible, make the turbinates smaller, okay? And then from the outside, tell me how you would like it.
The outside?
Yeah.
Well, I was just hoping that my nose piercing wouldn't move and hopefully be up my nose.
No, that's gonna be intact. That's gonna stay the same. But tell me what kind of a nose you were envisioning.
Honestly, I just hope this doesn't go up too much, and it's just pretty straight, and I don't want it to look too fake or anything like that. So more of a natural look. Okay. It's always my intention to give you the natural look. You have cute features. It's just that the nose, it's got a bump on it. It's a little bit wide there, so that will take care of, and something that will complement your look, your features. Sounds good.
All right. I took some photos with the Lift Tuck app, and I'm gonna show you as a preview of how I'm envisioning your nose to be, all right?
Okay, great.
So the Lift Tuck app enables you to have a preview of how the results will look. Smaller earrings. How do you like it?
I love it. I can't wait.
Okay, fantastic. This is gonna be pretty close to what the actual result's gonna be. And I think it's gonna complement your features very well.
Great.
All right? So if you're happy with what you're seeing, let's go ahead and schedule the procedure.
Let's do it.
All right, great.
Great.
So nice to meet you.
Thank you.
Turn towards me just a little bit. Chin up a little bit more.
I just met with Dr. Kassabian and I let him know all about my concerns and issues, and he showed me a preview of what my nose should look like. I'm really excited to see the results.
I just met with Aylen. She has two issues happening. First, she has difficulty breathing. That's due to deviated septum. Second, on the outside, she complains of a crooked nose and a bump on her nose. So my solution for this is to perform a septoplasty and turbinectomy to improve her breathing. And for the cosmetic part, I'm going to perform a cosmetic rhinoplasty where I'm going to be shaving the hump and make the nose straighter and less wide. Sometimes with rhinoplasties, I do perform chin augmentations. That's to bring proportions to the face. In her case, that was not necessary. All in all, the surgery should take an hour and a half with the recovery of a week. Time is important for Aylen because she's coming to visit from Canada and she's due to go back soon. Therefore, I'm gonna closely monitor her so that she's hearing properly, and also before, during, and after the surgery, take the proper precautions, such as the patient being off aspirin, being on arnica, bromelain, homeopathic medications to keep the bruising to a minimum. And of course, during the surgery, I'm very cautious so that the swelling and the bruising is to a minimum. So I do predict that she's gonna heal fine, and she'll be ready to have the cast off in a week, and she'll look good shortly thereafter.
Good morning. Hi, good morning. Today's the day of my surgery, and I'm pretty excited. I'm just a bit nervous, but I know I'm in good hands, so I have nothing to worry about.
Good morning, Aylen.
Good morning.
How are you?
I'm good. How are you doing?
Good. So today's your surgery day. Let's go over the plan. You have a deviated septum. It's deviated towards the right. First, I'm going to fix that, the septum, and then you have enlarged turbinates. Those I'm going to shrink them down. Next, we're going to shave this hump, okay, and make the nose more straight because it's crooked right now, and less wide. Any other concerns?
No, not at all.
Okay, so it should take about an hour and a half to 2 hours. When you wake up, you're going to have a splint on and packing, but you'll be able to breathe through it. Okay, so you recover for a few hours and you should do very well.
Sounds good.
Okay, give me a hug and we'll start.
Great, let's do it.
Getting ready to start Aylen's surgery. She has a crooked nose, and that's due to two factors. It's crooked on the outside, and that's going to be taken care of by the cosmetic portion of the procedure, where the hump is going to be shaved and the nose straightened. And also she has a deviated septum from the inside. The septum is in a C form and it's deviating towards the right nostril. So that's going to be fixed, straightened. And also she has enlarged turbinates. Those are going to be shrunk down so that she breathes better. So she's going to look better and breathe better, and I'm sure she's gonna love the way it looks because it's gonna complement her delicate features. Just got done with Aylen's surgery. Everything went very smooth. Her turbinate was enlarged, those were shrunk down. Also she had a deviated septum to the right that was fixed. This will make her breathe better. And then also from the outside, she had a hump and also crooked nose. The hump was shaved and also the nose is now finer. And now she has the cute nose that she was looking for that will complement her delicate features. Hi Aylen!
Hi, Dr. Kassabian.
You look so good.
Thank you.
For being 3 weeks out, you look amazing.
Thank you.
Alright, so how's your breathing going?
Oh, it's amazing. It's a
Yeah?
dream come true.
Okay, and you've been getting compliments?
All the time.
Fantastic. Well, what I'm gonna do is check your breathing, make sure everything's healing well, and then I'm gonna be taking photos, alright?
Good to hear.
And then turn towards him. Straight. So everything is healing very well. You're still swollen. There's a lot of swelling. For being 3 weeks out, you look fantastic already. But there's a lot of swelling, both from the outside and the inside. So that means your nose is gonna look better and your breathing is gonna be better.
Great.
All right, so I'm gonna need you to, on follow-up. You're from Canada, so when are you coming back?
I'll probably be back in February.
Okay. At that time, you'll be about 3-4 months out, and that will be a good time to check on you.
Good to hear.
All right, well, it's been a pleasure meeting you, and I'll see you soon.
Thank you so much, Dr. Kassabian.
Okay, you're welcome.
Thanks to Dr. Kassabian, I no longer need an excuse to tie my hair, and I have this great level of confidence and energy. I'm really excited to start university now because I'm no longer worried about who's judging me on my nose. Now more than ever, I feel like a woman that can finally begin living her life worry-free.
Aylen is a few weeks out from her surgery. Although she's still swollen, she already looks fantastic and her breathing is much improved. In the next few months, I expect the swelling to come down further and her nose is going to be more refined and her breathing is going to be more improved. I will see her in follow-up in a few months to check up on her recovery. Here at LiftMD Aesthetics, I perform rhinoplasties regularly. While most patients come in with cosmetic concerns, a lot have functional issues, breathing issues, due to deviated septum or other issues. As I'm addressing the patient's cosmetic concerns, I make sure that the patient's breathing issues are also addressed. At the same time, I look at the proportions of the face. Some patients have wide noses and they require a little bit of skin taken out from the corner of their noses. Other patients have proportionately small chin that make their nose look even bigger, and those patients require a chin augmentation. And often patients have a lot of fat in the neck area, and adding liposuction brings on a refined look to the face, and also the nose will look more delicate in that manner. While most patients come in with concerns about their nose, you have to look at the entirety of the face, because if you address the other deficiencies, correct the other deficiencies, then your result will be more aesthetically pleasing. Rhinoplasty is one of the most gratifying procedures for both my patients and myself. A procedure like rhinoplasty makes the most visible difference, and it can be truly life-changing.